Damage from hepatitis B isn't directly caused by the virus itself killing liver cells, as you might expect. Instead, most of the harm comes from your own immune system's response to the infection. When your immune system detects the virus hiding inside the liver cells, it launches an attack to try and clear the infection. This battle results in persistent inflammation of the liver tissue. Over many years, this sustained inflammation can cause healthy liver tissue to be replaced with scar tissue. This scarring process is called fibrosis, and when it becomes severe and widespread, it is known as cirrhosis. The ultimate danger of chronic hepatitis B is its strong link to liver cancer, specifically hepatocellular carcinoma, or HCC. It is one of the leading causes of liver cancer worldwide. The constant cycle of inflammation and cell regeneration in the liver creates an environment where genetic mutations are more likely to occur, eventually leading to the development of cancerous tumors. Understanding how these viruses travel from one person to another is key to prevention. Both HIV and hepatitis B are transmitted through contact with infected bodily fluids. However, not all bodily fluids are equally infectious. Blood, semen, vaginal fluids, and rectal fluids. It's also important to note what doesn't spread them: hugging, sharing food, toilet seats, or insect bites. The viruses need a direct route into your bloodstream or through mucous membranes. One of the most significant overlapping routes of transmission is sexual contact. During unprotected vaginal, anal, or oral sex, tiny tears or abrasions can occur in the mucous membranes. Anal sex carries a particularly high risk because the lining of the rectum is thinner and more fragile. This is why consistent and correct use of condoms is a cornerstone of preventing sexual transmission of both HIV and, to a lesser extent, hepatitis B. It creates a physical barrier that stops the exchange of infectious fluids. Another major shared pathway is direct blood-to-blood contact, commonly from sharing needles. When a person injects drugs, a small amount of their blood can remain in the needle and syringe. If another person uses that same equipment without sterilizing it, they are injecting the virus directly into their bloodstream. The same risk applies to sharing other items that can be contaminated with blood. Razors, toothbrushes, or tattoos and piercings done with unsterilized equipment also pose a risk.